March issue of Pediatrics and covers an alarming trend about the popularity of self-injuring or self-harm videos being viewed on the internet. And most of these videos do not have warnings about the content and the viewing restrictions. Joining us to discuss self-injury and the content that may be added to this is Harvard psychiatrist. This is Dr. Sharon Chirban. She specializes in treating young people who suffer with this issue. It's nice to see you this morning.
Nice
We're glad
to
you
see
could
you
come
as
in.
well.
Okay, so let's get started on the very basics here. What is self-injury?
Okay, self-injury is any self-injurious behavior. People have used the word cutting, and in maybe 5 years ago, people would think about cutting as being related to a more serious mental health disorder, like someone with bipolar disorder or someone who has a borderline personality. There are growing trends, and there's a use of cutting as superficial as using a paper clip to sort of rub away at the skin. And the understanding behind this behavior is that it's a coping behavior for some other kind of pain or distress.
Now, I'm so glad you just said that, because I was just chatting with some of the other ladies here, and I was saying this is such a foreign concept to me, and I don't know why a young person would do this. Are they doing it for attention value? Are they doing it to mask some other pain? And you're saying that typically it's something else that is the motivator.
It's a new behavior that kids learn about. So a kid might be at home sort of feeling sad and depressed, and I've asked, what made you think about trying cutting for the first time? They'll say, well, I've heard about it. And so one kid might go home and sort of start doing some superficial cutting and say, oh, that didn't do anything for me.
Right,
and then they
right.
kind of go on. They might go do something else, or they might go talk to someone and work through the issue without using the behavior. Other patients who've become regular cutters do experience some relief, and some actually talk about the pain as actually providing endorphins. And so it mutes or distracts away from some other pain, and it usually is some kind of depression or feeling badly about themselves, or, you know, a whole other topic right now is the bullying that's going on with the internet and all of that. But I've had girls be triggered by a bullying incident and then go cut.
Right. Is it more prevalent in girls than boys?
In my caseload, it's more prevalent in girls than boys. I think boys do other things to put themselves at risk.
Right. I'm sure that's probably true.
Drive really fast.
Right,
you know,
absolutely.
like that,
Sure.
that kind of thing.
Absolutely. Let's talk about this whole video YouTube portion of this, which just sort of makes the whole issue just that much worse. And you were saying to me, the internet, it's a place to go to find out bad information, but a place to go to find out good information too. But let's talk about the bad part of this first.
Sure. I've reviewed lots of videos, both in terms of kids. Kids right now are documenting everything about who they are. They've grown up, our population of kids between the ages of 0 and probably 30 have grown up in front of a video camera, you know, with the handy cams.
Sure.
And so they are now self-documenters, and sometimes it's a badge of honor. They'll take a video, they'll actually show a cutting behavior. Some of it is grandstanding. It's like, look at what I do, this is who I am. It can be seen as getting attention or competing with friends about whose disorder is worse than, you know, someone else's. I have as well seen videos where girls will actually get on and talk about the problems that their cutting caused them, or, you know, years later, you know, I have a hairdresser who has about 12 or 18 different scars on her shoulders from when she was repeatedly cutting. And the more serious the physical injury, it usually does correlate with more serious emotional disorder.
So let's talk about, as a parent, what you need to watch for, and what you can do about this whole internet involvement.
Well, again, I think we come back to it over and over, that supervision and good, clear, open, safe relationships with your kids is about the most control that people have. I'd say until about the age of 12, parents and families have a strong ability to limit what it is that kids have access to. I mean, kids as young as 6 are walking around with iPod touches, with access to the internet, with not a whole lot of restrictions on what it is that they can go to and see. After age 14, there's only so much you can do to limit what kids are looking at, where they're looking at it. So then all you've got is your relationship.
Right.
And so the better you're aware of what the potential pitfalls are, like not being outraged that kids cut, but instead if you hear that your child's even explored the behavior, early intervention, get them to the pediatrician, start working with the school, bring it to the attention of professionals. And often these kinds of behaviors can be nipped in the bud.
What do I physically need to look for?
Well, if you actually, kids actually will often put like a bandana around their wrist.
Okay.
So if they've been cutting, they will actually cover the body part where there has been some cutting. More experienced cutters will actually cut at the top of their thighs because they know that it's covered, and it would take, more investigation to find it. Any kind of repetitive injury that can't really be explained.
Right.
Ask about it. How did that happen? Do you remember what you were doing,
Sure.
When you got that injury?
Sure. Well, it's a terrible, it's very bothersome to me, just this whole concept that a child feels so desperate that they start to desecrate their own body in such a way. But obviously there's some help out there for these kids.
There is.
For the families as well. And if you think that maybe your child would be someone who needs some help, please, whatever you do, get out there and get the help they need. Doctor, it's so nice to see you. Thank you for coming in to see us. You look great in pink, by the way.
Thank you.